Thank you so much for that warm welcome. And I want to thank Shine and most importantly, all of the manufacturers tonight who allowed me to really evaluate and most importantly, give, feedback on all of the different pieces of equipment that we're going to talk about tonight. I am, again, a Shannon Brinker. I'm a dental assistant. I have been for almost 30 years now. Seems like a long time. and I do a lot of product evaluations. I was working with Dr. Michael Miller, for those of you that may have heard of him or know him, with Reality Publishing. I was one of his editors. I also work with Dental Advisor, which is an amazing company. And both of those, really, I learned from each one so much. I have to give so much credit for really teaching me and helping me to understand about product evaluation. I now do a lot of product evaluation, but it's very different than those two. That really what we're doing is we're bringing a total team perspective, and that's what I want you to get tonight. A lot of the feedback is not just going to be from me; it's from my team and some of the other clinicians that I have worked with, and really a variety of what we're hearing from them, how I feel. Most importantly, trying to put it all together and give you some some really perks about each one, but most importantly, having a better understanding of aerosol reduction. And that's what this course is going to be about. But I also want to make sure that with all the technology that has evolved over the last couple of years, we really want to make sure that with the increase in procedures, that now more than ever, it is critical to make sure that we not only have protection for ourselves, for our patients, but we want to make sure that we understand what does aerosol reduction mean and how do we do that. We want to make sure that we're not inhaling all these airborne particles that we see. And these aerosols really are produced by all the procedures that we do, whether it be restorative or in hygiene. And this is where we really have to think about what it is that we're utilizing, and most importantly, being aware of the risk, what we call invisible risk. And that's what I want you to think about tonight. And when you think about invisible, these are the risks that are taking place in our ops, whether we, when we follow these recommendations that we're going to talk about tonight, you have to be really serious and considerate when we think about, not just procedures during, or the aerosols during the procedure, but we have to think about before and most importantly, after. And that is where I think we really have to, I think with team members, we just assume that we're only at risk during a procedure. And you are absolutely wrong. Those are the things that I want you to really think about, because this is really a misconception, I believe, from team. When aerosols are created with a high-speed handpiece, ultrasonic scalers, any other instrument that the spray not only carries particles of water, but also bacteria, viruses, blood, saliva. We have to understand that these aerosols can contain up to 100,000 bacteria per cubic foot in the air. One of the most important things that we have to do to protect ourselves and the patient, the rest of our team, is to really reduce the aerosols and the droplets, what we will refer to as spatter or splatter or spray. We have to use intraoral suctions. There is no ifs, ands, buts about it. And believe it or not, there's still practices today that don't have this, this kind of control. And I have friends, most of them are hygienists, that are telling me that they do not have the equipment that they need to protect themselves and protect the patient. And this is something that, again, as owners of a business, we have to make sure that we're protecting ourselves, protecting our team and the patient. And that is a lot of things that we're seeing right now still in a lot of practices. When we think about aerosol reduction, one of the things we want to make sure is that you do have an understanding of what we use tonight to be able to put together this presentation. And not all of these slides and all this information came from me. We really gathered a lot of various information from the ADA, the CDC, from OSHA. I'm also a member of OSAP. And if you're not a member of OSAP, really encourage you to do that. And one of the things I will say is that I am a dental assistant, and what I'm going to be talking to you about is really from my point of view, but also, I'm going to refer to some of the resources. But again, this is based upon what we see and most importantly, what my colleagues are saying. I want to thank my good friend Lynn Richardson, who is a dental hygienist tonight, and getting her perspective and being a clinician, but also a speaker, and also my doctor, because one of the things that's tough in dentistry is to ask our doctors to try new things, right? So for any of you team that are out there tonight and listening to that, you already know what we're talking about, right? It is getting the doctor to let us try new things. So it's hard when we're really, we're creatures of habit. And so we want to release that tonight and really maybe open your eyes to the possibilities. And we also want to think about, what are we going to talk about tonight? How we as dental professionals can offer the most effective, practical methods to help reduce any type of overall risk of infection. We also want to make sure that we really thank all the manufacturers tonight that are going to take part in our evaluation, and most importantly, allow us to be honest with you, give feedback, and most importantly, talk about these products and materials and how we can really and truly have the most effective, practical methods really to help reduce that overall risk of infection. So tonight we're partnering with the ISOLITE, DRYSHIELD. We're going to show you the KULZER's Ivory Relief, DENTSPLY's PURVAC, and Zerk's Mr. Thirsty. And we're going to first focus on Xyrus ISOLITE 3. And a lot of team members and a lot of practices have had the older ISOLITE, and I want you to be very excited about this new component. So we're going to get into that first. But before we start, I want you to really think about aerosols. And when we say that, there was a recent study that basically confirmed that high volume evacuation removed more than 90% more aerosols than a saliva ejector. And I don't think that's something new to us. We already know that, right? That's not rocket science. But what I want you to really think about is what we know now is about 96 to 97% of the aerosol that we're worried about can be controlled with an HVE, not a saliva ejector. So again, it's something to really consider if you're not already doing that in your practice. When we think about utilizing the lowest, aerosols possible, generating any armamentarium that we can use when delivering any restorative procedures, hygiene procedures, it is really important for us to, again, have consideration. When we think about high, evacuations, we really want to make sure that whenever possible, we're utilizing them really to remove, again, any airborne contamination before it escapes, into any immediate treatment site. And we want to minimize the number of people also in the operatory. I was lucky that I'm able to go back with my 7-year-old because he has some special needs, but they were really, really adamant about us being careful. And I had to follow the same procedures, the same guidelines, and I really appreciated that. So when we think about, again, reducing the aerosols for contamination, anything that's going to escape, not only the operatory area, the operating area, and that is from the front to the back. Don't think because you work up front that you are not someone that's going to be having to worry about it. You're not someone that's having to think about all the things that we're really going through when we're in the dental operatory. The aerosols are just as important for you to know as the dental assistant, the hygienist, the doctor that's in the back. So we really want to make sure, again, everybody is careful. We think about the problem. A lot of team members don't really know exactly what that means. And the problem really occurs when we have these viral particles that are produced from coughing, sneezing, any dental care. These particles can potentially travel 20 feet. 20 feet. When we think about an infectious person, and then we, really think about secondary infections, elsewhere in the environment, we are, really, again, these particles really can contain in one area. They're suspended in, or can maintain in any area. They're suspended in the air. And even after the person who emitted them really has left. So even if your patient has gone, they coughed, they left, they can still infect us. That's what I don't think you understand. Even if a patient coughs, sneezes, and leaves our op, do you know that is still in the air? The surfaces are still contaminated, and some of the things that we really want to think about is the longevity of COVID-19. in various places. And let me give you some numbers here. When we think about, the virus, it is, viable up to 72 hours after application to plastic, stainless steel surfaces. It also is up to 24 hours on cardboard surfaces, up to 9 hours on copper surfaces. When we think about viable in suspended aerosols, it is up to 3 hours. 3 hours. So these are the numbers that you really have to think about and talk to your team about. And after you watch this presentation, you really should take it back and have your team really watch this, not just for understanding equipment that is available to you, but most importantly, understanding the time frame. Because I will tell you, and still we started doing more research, no one ever really told me about the time, and really looking at how long this is viable. So very, very important for you to understand and know. They also want you to really think about the least 3 potential sources, or at least 3 different ways or sources that these airborne contamination within dental treatment with dental instrumentation, saliva, respiratory sources, and really when you think about the operative site, these dental handpieces, ultrasonic scalers, we got these air polishers, air abrasion units, they really are going to produce the most visible aerosols. Each of these instruments are going to help remove material from the operation site, but we have to think about, again, the aerosol spray by the action of any rotary instrument, ultrasonic vibrations, combined any type of water spray or compressed air. The water spray usually is the portion of the aerosol that is the most visible to the naked eye. We know that, and also is noticed by the patient. But what is it that we don't see? When we think about where, we really want to focus on, the emphasis that, for a suction system here. And again, thinking about all the years that I was assisting, my face being right in front of the handpiece all the time, and even, just acknowledging that's not just hygienists. I mean, you think about an assistant, our head is bent and in the mouth, just like the doctor is. And a lot of times we're bent and deep in the mouth, probably because we can't see sometimes. No offense to you doctors out there. But we know that utilizing a high-speed HVE is going to help us with those large volume of aerosols. And, evacuator that puts a high vacuum really, it does not remove a large volume of air such as used routinely in hospital suction, but it is not considered an HVE when we think about what is it that we're utilizing. When we think about, evacuator that pulls a high vacuum, but does not remove large volumes of air, when we think about a saliva ejector, right? That is no comparison. And, the usual HVE used in a dentistry really has a large opening. We already know that. It has a large opening around about 8 millimeters or greater, and is attached to the evacuation system to remove these large volume of air, up to 100 cubic feet of air per minute. That's what we're looking for. So, again, going back to the saliva ejector, not to knock it because I use it, but we do want to make sure that you understand that's a small opening, and that is not going to remove these large, aerosols, and most importantly, large enough volume of air to be classified as an HVE. And so that's what I want you, again, to really think about. When we think about it, it's important that we've got this aerosol cloud to be controlled in the greatest extent that we can possible to make sure that we're reassuring, our team and most importantly, our patients. And we really need to recognize too that, there's lots of different ways that we can isolate for the patient, utilizing rubber dam when we possibly can, thinking about all the, the things that we can use to control that aerosol. But again, going back to the HVE, we know that, they say around 90%, but this number keeps changing and going up. So I'm seeing now from various resources anywhere from 94 to 96. And so for me, I love that number going up, and hope it continues to go up. But tonight, again, we're going to focus on, several different aerosol reduction devices. And I want to talk to you about those. And one of the things I want to make sure of is that you're using one, and you can't just do any quality dentistry without some type of isolation. And If you do, it won't. If you're not, it won't last. We know that. And one of the things that we see a lot is, when we're not using isolation, and we wish we would have, when we've got brackets that debond for orthodontics, we've got bonding crowns and composites, cements, things like that. When we think about, we should have been used a better isolation or use better isolation. And so this is where we really want to make sure that, we're making sure that our dentistry lasts. And so but it's also got to be easy, right? It's got to be easy, and it has to be comfortable for the patient. Has to be comfortable or they're going to complain, right? So this is what we really want to look at tonight. And the first one that we're going to talk about is going to be the ISOLITE 3. Now, let me tell you a little bit about the ISOLITE 3 tonight. Very different than the previous versions, okay? So what we see now is better visibility. We also know that with utilizing devices like this, we can make sure that we are minimizing that, contamination. We also have, brighter illumination. The one thing about the ISOLITE 3 is that you have a white light and you also have a true amber light. And I can tell you, we do a lot of bonding in my office. And the biggest concern for my doctor, even though he's wearing loops and he has a light, we got an overhead light, is, really concerned about us altering the setting times, based upon the light that's illuminated from his loops or from the overhead. And sometimes we even turn it off. But one of the things that I will say is that this really allows us to control it. And you'll see that by having that amber light within the ISOLITE 3, it really makes it nice to be able to control it. The other thing is that we can keep the ISOLITE, with helping us to be able to, again, isolate all the areas. But I want you to really think about this, is that we've got, controls where we can go up and really have, a higher volume of suction if we just need it to, come down a little bit. We've got these controls that really allow us to turn it up full blast, I would say, and then also turn it down. And let me just share with you just a little bit about the ISOLITE 3 and exactly how you would install it. I can tell you that with our team, one of the things that I did was that I didn't want them to read the directions. I wanted to see how fast they could put it together. And I will tell you that, it's a beautiful box. When you open it up, you're like, whoa, this is really nice. And everything is really compartmentalized within the box. But I really think the presence is again, a plus. And a lot of the components, at first when you open it up, you kind of get a little scared, but I can tell you that we were able to put it together pretty quickly, and most importantly, was pretty easy to again get ready for our patients. So let's look at this. Now, a couple of things that I want to do. I'm going to turn it down just a little bit so I can talk over it. One of the components here, you got to ask yourself anytime you're going to use one of these HVE devices is exactly where you're going to put it. We think about our high volume suction. We also have our saliva ejector, and I really only have one high volume suction hose. So it comes, you've got a splitter where you can have both, and be able to utilize that. Now, the first thing you want to do is we're going to have the hose. We're going to place the hose. We want to make sure that we are using a plug. Now, it does take electricity, right? Because we've got to have that light. Where is it going to come from? So we are going to connect the power hose. We want to make sure that we also have a plug close to the chair. That's one of the things I want you to think about, because in my practice, I have 2 rooms that are brand new, and I have one that should go into the Smithsonian. So this is where, you really got to think about where you're going to plug it in. Now, let's talk about how we're going to connect it with the existing hose. We're going to remove that, and what we're going to do now is really attach the connector to that hose. Sometimes it's tough to get it to go on there, and there have been times where I've had to take scissors and just cut a little tiny slit to kind of separate it a little bit. Now we're going to take the light itself, and we're going to connect that to that power vacuum base. We're going to plug it in, and one of the things we notice is the light is going to come on. Now we're going to unscrew one side. This is what happens when they didn't read the directions. But we're going to unscrew one side, and then this is where we're going to close it so we can keep that air from, making sure that it's really nice, tight. My team members didn't tighten this enough, so we didn't notice that the suction wasn't as strong. So just went up there, tightened it, and then you're just going to place the hose. You can see how it is really easy to sit down in where we would normally set all of our high volume suction hoses. Now we got the power, we're just going to hook it in. Just twist it. It's going to lock into place. Lots of different controls. We can have, a lot of, we would say, a lot of suction, a maximum suction, and then we can also turn it down. So just kind of, think about that, which is really nice. We also can turn it off from this device if we needed to. Okay, so that's going to really show us, exactly, again, having the different, having the different controls. Now, let's talk a little bit about the ISOLITE 3. When we think about, again, going back to the pluses is having the 3 levels of light. They also having that ambient light is really great. Having on the top of the ISOLITE itself, we can turn it down. We have 3 different levels. We also have, really thinking about different, sizes. And let's talk about that for a little bit. When we get into the sizes, it's got several different sizes, but I also want you to think about, having these light pipes to be able to make sure that we can keep everything clean and most importantly, be able to, see as many patients as we can, without having to worry about, decontamination. We also want to make sure that and this is probably the most important thing, and I kind of stole it from ISOLITE 3, is making sure that whenever we're using any devices just like this one, but I tell you, I really like what they did. They really gave us some sizing. When you think about pediatric, extra small, you really want to only have 1 finger, and when you think about bumping up to the small, you're going to have 2 fingers, medium is 3, and the large is a 4. Now, I also want you to think about this is that I think the misconception is that we just assume because the patient is a tiny patient that they're going to need an extra small or a small. And that is not true. This is a true test that you really need to think about the opening here, because this is not a, these ends are not autoclavable. So once you put it in somebody's mouth, it's a single use item. So I do not want you to just waste them. And that is something, again, that I had to tell my team that doesn't really, at the time, didn't really know when we were opening the box and they were putting it together, because they were trying it in on themselves. And I would tell you that I always want to try it in on me. I always want to know how it feels, how we're going to put it in, and most importantly, again, what the patient is going to go through. But the last thing you want to do is not really follow the ruler, I would say, and waste the ends, because again, it's a single use. When we want to also instruct the patient when we place it in the mouth that we ask them to open wide, really as comfortable as they can. And again, after we do the measurements, and then what we're going to do is we're going to, take out, making sure that we put that away, but most importantly, making sure that we place it in the patient's mouth correctly. So first thing that I want to think about is, all the different sizes, which is great, but I will tell you some of these we did not use as much as we did others. We didn't use the pediatric because we really don't see any kids in my office, but I will say that if I had a pedo office, pediatric and extra small would probably be the only ones I would ever utilize. In our practice, we really utilize the small and the medium. They do have large, but I will say that, when I go back to reordering, I'm really probably just going to utilize the small and the medium. But again, it is nice to have the 6 different sizes, and again, having that to really fit a wide range of patients. So it really helps us to think about all those ages, right? So let's talk a little bit. Let me show you. I was actually the patient for this one, and this is why I said, it's really important for me to know what it feels like. I always want to know what it tastes like, whether it tastes good or not. We know in dentistry nothing does, but I really wanted to know how to place it. But most importantly, I wanted to watch my team do it and just kind of see how easy it was. You can see here that Cindy is placing it, and one of the things that I will say is, want to make sure that you are placing it, but you're following the insertion of the bite block. That was one of the things as I was watching her put it in, making sure you follow Again, the anatomy of the occlusal surface of the maxillary and mandibular arch. You can see how bright it is. I mean, it is super bright. And I think that was one of the reasons why they gave us the 3 levels of illumination. Because I can tell you, if my doctor has his light on, I've got the overhead light, and then I would have this light shining as an assistant. It's a little blinding. So that's a huge plus to be able to turn that down. One of the things that I will say my doctor really enjoyed was the fact of not having to use the overhead light. As a matter of fact, we actually now we turn off the light of the op. And one of the things that we do see is a lot of anxious patients and those patients that, are fearful of the practice. And I will say that there is something about turning the light off, or the operatory light off, gives them a soothing effect. But by having this illumination, it really allows us to do that. Because if I am, as the assistant, just relying on my doctor's loops and they move around, which he does, I wouldn't be able to see, and we know as assistants, I can't have a light on mine and him have one on his, because we would do a light show. So this is, I think, a huge perk. And again, having the 3, because if it was just a 1, it would be tough to utilize it. So I think that is really, really great, and making a decision on what works best for you. And if you're working alone and you don't have a light source on your loop, so again, a good plus. Let's look here. I think this was the most, I guess, great thing, and what my doctor thought was the best part is that he was able to get his hands in there, edge the tooth, place bonding agent, but most importantly, has big hands. So that was really, I think for him, was the best part, because being able to push the tongue back, because we know some patients have tongues that are like a wild animal, right? You want to cut it off. I'm not one of those patients, but I've had patients like that. And so I really feel that this will help control that. Now, listen, some of the other devices we're going to talk about are going to retract the tongue as well. So I don't want you to think that, I'm just giving a hoorah for the ISOLITE 3, but it is the first one. But one of the things, again, that I think has the number 1 perk is the 3 levels of light. And most importantly, having this illumination, ambient light that we can really control. As you can see here, he is cementing 2 of my crowns that had to be bonded. And I do not want that cement to set up and then have to use a little saw blade to get that cement out, right? So again, that's really a great plus. And he's really talking to me about it as I'm sitting in the chair and giving me some feedback, which I love. And most importantly, hearing Cindy's feedback is really good, because I want you to know that you will not have to give away your you can't just not have an assistant. One of the things I think a lot of assistants worry about is that they're going to do away with us. And I hear a lot of the ads, and I see a lot of this, it's an assistant to the doctor. You really don't need an assistant anymore. And that is such a lie, because listen, that is not true. It will aid in the fact if you're working by yourself. A lot of EFTA assistants out there are placing composite. Hygienists, I think there's a lot of hygienists that really enjoy it. My good friend Lynn, who I mentioned at the very beginning, she absolutely loves the ISOLITE and she cannot live without it. And I think this is where we really and truly, want to think about the hygienists, from that point of view too. So let me share with you Lynn's video. Here she's using the ultrasonic, and she also does a lot of laser therapy. And if you haven't ever seen her courses, you really have to check those out. She is amazing. But she cannot work without the ISOLITE. And she told me that. She's like, I can't even do dentistry, and I don't think that I would even see patients if I didn't have it. And when COVID hit and she was moving into a new office, she didn't have an ISOLITE. So she was having to hold a high volume suction. And she said, Shannon, she would call me just about every day. Oh my gosh, I am dying. My hands are killing me, because she was trying to hold the HVE. And we know that hygienists are not trained as assistants are, right? I mean, there's no ifs, ands, or buts about it. So to ask a hygienist to retrain themselves to hold the high volume suction is really tough. I mean, it's really tough. And for you hygienists that are listening tonight, you're shaking your head, yes, that you do understand and feel the same way. So again, a lot of really good perks here, having the light, very, very easy, again, to control any saliva. The suction is nice because you can turn it up or turn it down. I think having the ambient light, again, another plus. You really do need to read the instructions and making sure, like I said, I had my team open it up and try to put it together, and there was some stopping and go, but in the end, it was, fairly easy. But the biggest obstacle was the plug for me in an old dinosaur, op, right? because there wasn't really one close to my chair, and I had to actually have the cord kind of hang or in the floor. But for these new ops, and we were a lot smarter whenever we got the new equipment and the new ops, right? So that won't be a factor, but just kind of keep it in mind where it's going to be, and that way you can utilize, because it's going to need a source, right? So that's enough for the ISOLITE 3, okay? Now let's talk about the ISODRY. The ISODRY, is a very, very good product. There's a couple of perks that I really enjoyed and liked about this product. With the DRYSHIELD, and we think about the difference between the ISOLITE and the DRYSHIELD is this one doesn't have a light, okay? And so when we think about, the DRYSHIELD, this is something that, when we think about the comparison here, and with the, now let's talk about the DRYSHIELD. Now, one of the things that I want you to really think about is the DRYSHIELD compared to the ISOLITE 3. The DRYSHIELD does not have a light, okay? But there's a lot of good perks that I really enjoyed about the DRYSHIELD, and that's what I want to kind of just mention. It is a high volume, isolation system, very similar, and it does have bite blocks that are firm. We can remove the bite block, and I think that was probably the number one perk for me, is being able to remove the bite block. Having that bite block that you could slide off and not have to use it if you didn't need to, or if the patient maybe is complaining or maybe has some discomfort from utilizing the bite block, you can remove it. And I will say that I like the fact to be able to remove it and use it for other procedures, right? Because sometimes we don't utilize this type of system for maybe a procedure if a patient has a bad disc, joint issues. We have to be really careful, but I will say that it was nice to be able to now have an extra bite block if we needed it, and it just slides right off. So that to me was a huge perk. The other thing is that I like the fact that we could mix and match, any combination of the ends, and most importantly, you can sterilize it. That is number one, being able to sterilize it. And I think that's where we think about waste. We think about sometimes landfills. I know people think about that. But most importantly, being able to, if we tried it in and it didn't fit, we could try in another one, right? And we wouldn't have to worry, or most importantly, have that payroll deduction, from wasting that, that end of the device. So I think this is where the mouthpiece. So this is where I think, again, the difference between the DRYSHIELD and the ISOLITE 3 come to play. Now, once in place, we had really good retraction, suction, airway protection. I think those were the things that were really nice. It is made of silicone. And I want to share with you a couple of things that you may see here in your photo. I like the fact that this little white end that basically you would pop on your mouthpiece, it was really nice and smooth. It sat up higher, which was I think a perk. But again, I like it was slim. It stood up higher whenever we would sit it into our holder. That was nice. The other thing is that I love, because if you have an old op like I do, and I keep harping on my doctor, maybe we'll get some new equipment sooner or later. I love the fact of having the metal hook. Now, there's a metal hook, and if you look closely, you'll be able to see that. I liked having that hook, and I'll tell you that one of the things that I did was I hooked that onto the arm of my chair, because I have an old unit, and sometimes these hoses can be really, really long, and being able to have the hook to hook that onto the chair was nice, and so I really did enjoy that. The other thing is that
twist
when
it
you
off
think
from
about
the existing tubing
this
and
area
attach
here,
the DRYSHIELD
I'm just going to kind
DS1
of lower it
onto
again,
it.
just like we did.
Place it back on the
Same
toolbar.
thing. A lot of times with these
You
hoses,
have now
it's going to be
converted
really
your room
hard to get
into
it
a
in there.
DRYSHIELD
Sometimes
room.
what I found is we use
Select your mouthpiece.
Vaseline.
Select the
to kind of
correct
lube
mouthpiece
it.
size
Sometimes
to
I've had to
ensure
take
a
scissors
proper
again
seal
cut it.
and for your patient's
but
comfort.
here is the
Prior
mouthpiece
to
device.
insertion, spray a mixture of air and water
You
on the outer
always
surface of the
want to
mouthpiece for
lubricate
moisture.
these. Make sure you've already
Also,
got
spray
water
the inner
in
lining
them.
of the
When I'm
mouthpiece
running
for
my
additional
handpiece,
lubrication.
I also will lubricate
Slide the
that.
mouthpiece onto the DS1
You'll see
by
it has a
rocking
little
it
hole,
back
so
and
it's just going to
forth
fit
until
right
it locks into place.
the holder there, and you can turn it on.
DRYSHIELD is the newest innovation in dental technology that creates a better...
And I'm going to pass through some of this because, that's just verbiage here. You'll see how it is, how it looks. It's got a tongue shield just like the ISOLITE 3. And it has a cheek that holds back the cheek. We've got the bite block. And again, the bite block, I'm going to back up just a little bit, can be removable. Okay?
Mouthpiece, fold the tail towards the center of the mouthpiece. Next, fold the sides together.
You can fold this
Ask the
just like you
patient to
can the
open their
ISOLITE
mouth
3
while
and also
reminding them
Mr.
to
Thirsty.
focus
We're going
on
to talk
breathing
about it in
through
a
the
minute.
nose to promote relaxation. Slowly
Watch how
insert the
she's going
mouthpiece
to
lining
insert
up the
that.
front
Again,
edge of the bite
following
block with the
arch
distal of
form,
the
but most
canine.
importantly, sliding
Then
it back.
let go of
This
the
is one of the things
mouthpiece,
when I was watching
letting
my
it
team.
adapt to the oral
It has
cavity.
to, your
Use
maxillary
finger pressure
arch
to
and
adapt the
mandibular
cheek
arch has to
retractor
fit
along the
inside
inner
the bite
surface of the
block. So
cheek.
you really want the patient to
Adapt
open
the
as
top
wide as
of
they
the
can
mouthpiece to the
and push
palate
that
and the
back.
bottom of the mouthpiece to the floor of the mouth.
Now, I'm going to pause it for just a minute. Do you see, this is something that, again, not just about the DRYSHIELD, all of these devices, you've got to place it straight back, and it needs to really sit on the tongue almost. It's going to pull the tongue back. Now, listen, there are some patients that, again, have that wild animal. My daughter's one of them, which I'm going to show you in a minute. But one of the things you really still want to tell them is it's going to push your tongue out of the way. Don't fight it. It's going to help you, trust me, to control saliva in the back of your throat. But most importantly, it's going to give you comfort to be able to bite down on it. The back of the device itself is going to go wrap around the last molar. You can see that, right? It goes right around the last molar, and the end of it is going to come up into the cheek area.
The narrow portion of the mouthpiece should be distal to the most posterior molar. Reposition the upper and lower lips around the corners of the bite block.
Now, remember that if you're working on
You
one
are now
side,
ready to do DRYSHIELD
working on
dentistry.
the, on the patient's
Again,
left,
don't
this is
forget to
going to be on the
remind
right.
the
And you say,
patient
"Duh,
to
Shannon,
breathe through the
believe it or
nose
not,
during
there are
use
people
of the
that may have
DRYSHIELD.
not put it in correctly."
When treatment is completed, have the patient open wide and gently remove the mouthpiece.
Now, this is something that I did see again, and I just want to mention one of my team members doing, they just grabbed it and ripped it out of the patient's mouth. And I'm like, no. Because you don't want to, first of all, we're putting something new they've never had before. Second of all, you don't want them to be thinking about the last thing that you did on them was take that and rip it out, right? So just take it and, just kind of roll it out from around the last molar and pull it out of the mouth, okay? So again, making sure that you're doing that correctly. Now let's skip ahead just a little bit. You just remove that, okay? And now what we're going to do is we're going to clean it off with a little brush. I don't really use the pipette.
Once the
or what we call
mouthpiece and
pipette.
bite block have been thoroughly
But
cleaned and
again,
rinsed,
if there's
you are
things
now
that
ready
maybe
to
have gotten clogged,
sterilize
like
them.
calculus,
Place the
any
bite
kind of
block and
debris,
mouthpiece into an
maybe
autoclave
could be
pouch
some
and
old
mark the
crown
pouch
material,
with the
some,
size and number
metal.
of times
You
used.
can just take the little pipette and
You
go
can
through
now
each
put it
little
through the
hole.
steam autoclave
Okay,
along with
and
the
then,
rest of your
and
dental
then,
tools.
again, you're going to place it into a pouch, put it into the top of your autoclave, and autoclave
Selecting
is
the
based
correct
on the
mouthpiece
manufacturer's
size will lead to a
instructions,
proper fit
okay?
and seal.
Ultimately leading to an ideal isolation retraction.
The other thing is I just want to jump ahead here just a little bit. Again, same thing. I will tell you that the field of really being able to get in there with a handpiece, a mirror, was the same as the ISOLITE 3, and it will be the same as the Mr. Thirsty. So don't think that one is better than the other as far as the patient and opening and working field, okay? The one thing, though, that I will say, and they're absolutely right here, is, you again got to do that same measurement, right? The same measurement, because for my daughter, I thought she was going to be a small, and she actually was a medium, okay? So make sure that you're paying attention to that. Again, the patient wants to move their tongue. You can
Simply
see here.
reminding your patient to
and
focus
so
on
that's
breathing
something that,
through their
again,
nose
when they're
will
biting
relax
down
the
and they push on
and
it with their
correct
tongue,
this.
it's not going to come out, but again, you want to tell them and give the patient instructions.
Remind the
This is where,
patient to rest their
one of my
teeth
team
on the
members
bite
failed
block
to
versus
really
biting
let the
down
patient
hard
know
on
that
it.
I don't want you to
Biting
open, because if you
too
open,
hard
it's
on the
going to
bite
move.
block may cause
But if you
patient
feel like you
discomfort
need
and
to take a
displacement
break,
of the
we can
bite
take it
block,
out
as
at
well
any
as
given
decreasing the
time.
patient's
So,
vertical
again, just having
opening
that
and your
communication with the
visibility.
patient. The verbal skills is something that I can give to you because we're making notes for our own team. And,
To attach
and
the
that is
bite
something
block
that,
to
again,
the
you,
mouthpiece,
can have
squeeze
from
the
us. Here you
mouthpiece
can
while
see where
simultaneously
you
pulling
really,
the strap on the bite block
just
over
all
the
the different
mouthpiece.
areas where you can
Slide
put
the
things
strap
together.
into the notched
being
area
able
on the
to,
mouthpiece and slide
most
the bite
importantly,
block
getting it
onto
wet
the
before we place it in the
mouthpiece.
patient's mouth.
With an index
we
finger,
can
press
have,
the
it was
plug
very, very
into the
easy
bite
to
block
assemble.
undercut slot.
And,
Ensure
here,
a snug
like I said,
fit
you
and
almost
that
don't
the
have to
bite
read
block is
instructions.
locked into place
But,
with the strap
again,
lying
really easy to
flush
put
with
together.
the
You can see
mouthpiece.
also where we could
To
slide
detach
off
the bite block from the
and
mouthpiece,
utilize that
pull
for
the
other
bite block
procedures.
off of
So
the
that was kinda
mouthpiece,
nice.
detach it from the plug, and gently slide the bite block
cool.
strap off of the mouthpiece.
So that's probably one of the things that I like the most. And then just moving along here, just looking at the hose.
Ready
Again,
to
having a
dedicate
splitter,
one end to
is
the dry
nice
shield
if you need
and
it,
the other
but
end
every
to a
one of
second
those,
high
or
suction line.
DISPOSABLE 3 has that as well, where you can still use your high volume suction and then utilize
Don't
the
forget to
DRYSHIELD.
give your patient encouragement and
Now,
to
let me just
and
show
to
you
remi-
really quickly the one thing that I was talking about as far as the getting into the little metal hook. And I think that we've got that on the next slide here. No, I guess we don't here. I apologize. But I do like the fact that, again, that little hook that I reminded you about, that to me was a really big perk, probably the number one perk other than the being able to sterilize it. Now, let's look at Haley real quick. Let me show you what we did here. I was basically getting her ready to repair 2 sealants. And, that patient cooperation is very, very important. And again, thinking about explaining things to the patient. And most importantly, going back to that lubricating it, making sure that it's wet, because that was something that, again, one of my team members didn't do. Okay? No matter what side you're on, really had good visibility, again, and able to, maneuver back and forth. So that's the DRYSHIELD. Now let's talk about the Mr. Thirsty. The Mr. Thirsty is from Zerk. The Mr. Thirsty is basically what we would say, when you think about economic cost, and one of the things that we see a lot, which is even in my own practice, we have 25 ops. Yes, our office is kind of like a mini village, I would say. And but we have to be careful, because if one of us is using one type of isolation device, sometimes the team members get a little jealous. And we have 5 dentists. We've got a pedodontist and 4 general dentists. And my doctor said, there's no way that I can afford to buy an ISOLITE for every room, or, an ISODRY. So I need options. And so one of the things that was great about the Mr. Thirsty was, the expense of ordering it. Now, the other thing is it is disposable. It comes in 2 sizes. Sometimes having too many sizes can be confusing to the team. You think about a small, a small or extra small, and then a medium and large. I can tell you that most of my patients were the medium or the blue, and that just made it really easy. The only time we ever used the purple is if, we had a pedo, and that's going to be in Dr. Sproul's room. And so that's when he's going to really use it. But it was easier for him, again, to be able to just choose that as well. Simple, easy to really just place it right into the suction, and you're ready to go. So just want to show that and demonstrate that really quickly. It is only one step. So you open the package and it's ready to go. So here you'll see you just put it right into your high volume suction, bend it a little bit, and then just place it right in. Now, there are sometimes when, some clinicians like to go ahead and put it behind the last molar and then slide it. Personally, I like to get the bite block in first. Only because I just felt like it made it easier. But again, there's no right or wrong. Make sure too that you don't gather or capture the patient's lip in that, because you definitely don't want the patient to to get an area there where they're hurt their lip. Okay, so this is how it looks. This is basically, again, nice and smooth, and a lot of team members will say, well, do you have really good suction with this? Because it's the disposable and very easy to just connect. And I have to tell you, yes. I mean, the suction on the Mr. Thirsty is very, very good. And you would think sometimes of something like that, it may not be. And I was pleasantly surprised. The other thing is that if you want a hose, you can order it. So that's an option, and if you need an extra hose, or you want to make sure that you've got an extra way to be able to still have your high volume suction for assistance, and then also have an isolation device, you can do that, and they offer that in a kit. The other thing is that you can get it from 25 in a pack or up to 100. And again, the pedo small is what we're going to utilize for the purple, and then the blue large. What I would say is really not an extra large. It's really more the medium. That's what we're going to utilize for the blue. And so again, let me look here and let's show you how Haley did really quickly. You can see that it's nice and comfortable for her, and it was just really, really easy to get in there and just have her bite down. The other question is, some team members will feel like, they would ask me, well, do you feel like that's going to fall out because it's so short and it doesn't really have the extension as some of the other high volume aerosol systems that we're utilizing? And no, I didn't feel that it was going to pop out. I didn't feel that it was going to, move around. And there is something to be said to have your own hose, because sometimes some of the hoses that we're utilizing are stiff and hard, and they don't really bend as much as the one that we're used to utilizing. So that's one of the things that I think we really got to look at as well, is the hoses have to be comfortable, and they have to be bendable, right? Because we're not just going to sit and wear them in or work them in, and down the road they're going to get softer. It's really not going to happen here. So we want to make sure that that you know that. Now let's move on to the next one, the relief. I was really blessed to actually have this prior to really anyone in their practices, and because I did a lot of sealants and I taught a lot of courses to dental assistants and dental hygiene assistants. And so, KULZER came to me and said, hey, we've got a new product. We really would love for you to evaluate it, because a lot of my team members were using dry angles. And, sometimes we forget to wet them, and they would just take them out and then pull some of the tissue, and cause some irritation in the patient's mouth. But most importantly, constantly having to replenish those dry angles sometimes can be a pain. Now, I'll tell you, in this day and age, there's better dry angles than there used to be. But one of the things that I think about the relief is a couple of perks to that. It is easy to place because it's going to go right into the patient's cheek. It also is very easy to utilize in hygiene. And I think this is where it lies. My hygienist absolutely loves it. And we see a lot of elderly patients. We actually have patients from a nursing home come to our office, and we work on them, and it's hard, and there's no way, I can be honest, that we're going to be able to put a bite block into a lot of these elder patients' mouths. But the one thing about the relief is that they can close on it, which is something that I think they really like, right? We're still getting a lot of the saliva and really having those aerosols controlled. But one of the best parts, I think, is being able to bite down and close. One of the things that my mother-in-law, God rest her soul, she passed away due to COVID. And one of the things that she hated was the fact that our ultrasonic, it was a dinosaur too, sprayed out so much water, and I could hear her coughing or getting choked. And these are reasons why we utilize a lot of these devices as well, is to help with the saliva pool, but most importantly, helping those patients, if they're coughing, to not interrupt procedure time, and then controlling the aerosols, right? But before we had COVID, that was the main concern for us, is every time the patient would cough, we'd have to stop, or we'd have to sit them up, or we'd have to give them some water. So those interruptions of procedures is a huge plus now with all of these devices. The other thing is that the leaf is disposable. You can just take it right off, toss it. It comes in a bag of 100. And then we basically just utilize it. It has three hoses, so you can place those right into the autoclave, which is very good. But again, I feel like there is uses for each one of these devices, and where I feel it lies is in the hygiene chair. I think it is really, really been more accepted when we think about hygiene. Okay, and so other thing is you can easily just maneuver it pretty quickly. That's something that's a little bit different than some of the other devices, because you can just loosen it, lift it, and just slide it right, just reverse it, right, and place it right back in where you were. It also has this U end of the hose, which allows us to kind of hook that onto the patient's mouth. And one of the things about my hygienist is they were used to bending the saliva ejector. So this is where, it was something that felt good to them, is the fact that they didn't have to change their technique too much, because they were always bending the saliva ejector, and now they don't have to do that anymore, right? So this little U shape, which I'll show you in a minute, allows it to just kind of hook into the patient's mouth. And so that really is something that I think was a huge plus. So let me just show you quickly how you put it together. And all you do is just slip it right into the HVE system, or again, you can use the hose. Personally, I like to have a longer hose. I thought this was really too short. And so I like to have the hose. So what I will do is I would have the hose and just place it onto the end. It has a really long extension here. We're going to place that right into the high volume suction. Okay, as so. The other thing is that the hose might be a little bit long. So the beauty is if you needed to cut it, you can. We just use it. I got this from Andy for A Tale of Two Hygienists. If you've never heard of Andy, he does an amazing job with his hygiene podcast. I love listening to him. And this was a huge tip that I got from him. He just used a pocketbook hanger, because sometimes with the relief, it was hard to get it to, you didn't know where to put it because it didn't have a lock in on the hose to be able to really sit it somewhere. So if you take your HVE and you sit it back into the holder, the leaf kind of hung, or the hose kind of hung down, or we'd have to, wrap it over something. So I thought this was a great idea. And having that pocketbook holder, I think, was a huge plus. And so, KULZER, if you're listening tonight, go buy some, pocketbook holders and put them into the relief kit. I think that was really the most important thing to, really remind us about, right? So here we are, we're using it during the procedure. You can see that we're utilizing our ultrasonic scaler, and again, hygienist is using the relief. You can see the little hook, and really just getting right into the cheek area. Very comfortable. It's very soft. It has 3 holes, so it's going to help, pull that saliva. And really taking a look here. I like to usually turn up the volume so you can really hear it. So yeah, taking it out and being able to go back and forth, I think, again, huge perk there. All right. Now, I will say that KULZER just came out with a small version. I call it the pedo, but it's really not the pedo. It's a smaller end, because one of the downside, probably one of the only downsides other than not being autoclavable, because it's not, it's disposable, is the fact that and no bite block. Again, some doctors, we think about our occlusion camp doctors, Pankey, Dawson, Spear, they don't like to utilize a lot of bite blocks, because they do worry about joints. So that's something to think about. This one does not have the bite block. But the other thing is having that other size. One of the things that a lot of team members would say is, I wish it was smaller, because not all patients have this large mouth. And sometimes they would take a scissors and kind of cut it, because it is nice and soft, but it's nice to be able to now have that other size offering. Okay, so let's talk about the PURVAC. This is a suction device, HVE device from DENTSPLY SIRONA, and it's fairly new. The one thing about it is that it does have a mirror-ended tip. It really allows us to utilize one hand, and that was something that I think hygienists really like. And the end is very wide. So when you think about your standard HVE tip, yes, we can suction a lot of aerosols and a lot of saliva, but this one kind of comes out a little bit wider at the end. I think honestly that this to me would be really good in hygiene. And also in our chair as assistants. The only downside is I felt it was a little bit short. So if I could ask, DENTSPLY, and I love all of their products and really enjoy utilizing a lot of the materials that they invent or they have. The one thing that I would say is this is really made for a hygienist's hands and not so much an assistant's hands, because I feel it's a little too short. So DISPOSABLE, make it longer, okay? But I will say that having that mirror on the end is a huge plus. And the other thing about the mirror is it doesn't fog. Now, when I say that, it doesn't fog, a lot of hygienists, their ears perk up, because that's one of the things that, again, going back to having to stop or having to wipe your mirror, things like that, it's something to really, again, think about. We also want you to know that you will, as a hygienist, if you're utilizing it, you're going to have to train yourself to go back to utilizing an HVE, and it's going to take some time getting used to, okay? So again, want to make sure that you know that. The other thing is that it is a little bit heavier than your metal mirror. And listen, that is not something that DENTSPLY can control. Anything that's going to be hooked to a hose is going to be heavier than something you're just holding a metal instrument. So you can't compare that. And this is one of the things that I see a lot. Is it being compared to a instrument? And that's not fair to DISPOSABLE. That's to me not fair to them, because of the fact that it's not the same. They're very different. So when you think about holding it, and again, hearing hygienists say, well, this hose is heavy, and it's really hard to hold the mirror. Again, very differences in that, right? And so you can't compare it. I'm going to tell you now, and that's not right if we are. Again, looking at it fogging up and not having that, that's really, really a great perk. The other thing is being able to have that reflection, I think, is also a plus. I will say that this is a really, really good product when you think about doing laser technique. Lynn does a lot of laser therapy, and she did like the fact that she could get really, really close up on it. The other thing is she does a lot, again, utilizes a lot of lasers. She gives a bazillion courses on laser therapy for hygienists. And I can tell you that when she's got a herpetic lesion, that is right on top of it. I mean, right on top of it. And, it's something that she really is scared about, right, doing, and she really wants to make sure that she's protected of herself, especially now more than ever. But having this is one of the things that she said was it really gave me a little bit more peace of mind. I wish I'd had it a long time ago, because she does have a lot of patients who return for her to perform that procedure. So again, I think that's a plus. The other thing is that again, the opening is wide. We also know that the mirror is there. It is round. Now, one of the things about a lot of HVEs out there is that it's sharp because it's cut by machine, and it can cut the mucosa. It can cut the tissue. We can cause sometimes little canker sores with it, especially if you're a new assistant out there, and we know that, right? We're sucking up the tongue. Now, listen, this is forceful, okay? So be careful. The downside to me was I had to be really careful because I almost sucked up a cotton roll, because if you're, holding things and passing things to your doctor and you're not really paying attention and you've also got some cotton rolls in there, you can easily suck that up. So don't think that it's not strong and has that force to really make sure that we're, getting the aerosols. It does. So that's one of the things I want you to really be careful about is where you're placing it. Ask me how I know. All right. So again, let's back up just a little bit. The hose is stiff. Okay. I cannot lie. That's going to be a question I know that somebody's going to ask me. Yes, it's very easy to stick right into the suction hose. And most importantly, it already comes with 3 ends to it, which is nice. They're all autoclavable, which is really nice. I will say that in my practice, we ordered 3 more because I wanted my hygienist to be able to have enough pretty much throughout the day, not to be forced to have to worry so much about not having one. The other thing is, again, you're going to have to train yourself. Okay, no ifs, ands, or buts about it if you're a hygienist, because again, we're not used to holding those. They're not used to holding those. But having the mirror that doesn't fog up is also a huge, huge plus. The other thing is I like this, and I'll tell you, I kind of stole it so I could utilize it with all my new assistants out there, because it's hard when you're a new assistant to really remember where you're supposed to sit and where you're supposed to place your suction. So thank you, DISPOSABLE, for making this. I did steal it. So again, thinking about having the having the hose, having the 3 extra HV ends to it, and just being able to, you can pretty much know that you're probably going to order some extra mirrors to go in that. Okay, very easy to retract, and I think the easiness comes from being able to have the rounder end that's larger. And again, looking at that, let's show you a quick video. This is Clarissa in my practice. You can see here where she's utilizing it to retract the tongue. The hardest thing for her, again, is learning how to do that, right, and maneuvering it. So you are going to have to train yourself, and especially knowing where you're placing it. So practicing with it. Again, in dentistry, we always think we're going to use something one time, and we're going to get it, and if it doesn't work, we're done with it. And that, again, is not fair to the manufacturer. A lot of times when we see downfalls, or when we see things that happen with materials and instruments that we're using in dentistry, I will tell you that we blame it on the manufacturer. We always say we blame it on them, and we never take the responsibility for ourselves. And most of the time we didn't either read directions, because I'm gonna be honest with you, a lot of times you don't read directions, right? We'll look at pictures, but we don't read directions. The other thing is we want to make sure that we try something at least 5 times. And I learned that from Michael Miller with Reality, and I so appreciate that, because so many times, more than I can't even count, we'll try something one time and we never utilize it again. And it is a learning curve. And then until we use something at least 5 times, we cannot judge it. We cannot evaluate it, or just throw it aside and never use it again. Because that to me is sad. You made this investment into this equipment. It's kind of like having a CEREC machine in the corner and never touching it. We see that, having a scanner and we never utilize it. You have to tell yourself, I'm going to utilize this. And the other thing is making sure that we're protecting ourselves. And that is the most important thing here. So again, looking at, harmful aerosols and going back to that, 90% is what I hear. And it goes up anywhere from, again, 90 to 95. It's kind of hard to get that number nailed in. But, thinking about, this, these aerosols and comparing it to saliva ejectors, I'll tell you, we don't even use it unless we really have to now, because of all these devices. They're just amazing. And I can say that, when you get into deciding which one that you want for your practice, this is the hardest thing, because, you have to really think about, what is it that you're going to utilize it for. So I'm going to sum it up just a little bit for you, okay? And again, I really enjoyed all 5 of these, and I can tell you that I'm keeping all 5 in my practice. Why am I doing that? Because I feel like with my team, one's going to like one versus the other. And boy, is it a plus to be able to have a selection for my team to decide what really works best in their hands. And so when I back up a little bit, I feel that with the ISOLITE 3, for, Lynn, she loved it because she had the illumination. If you have a hygienist that doesn't have a light on their loops, this is such a huge perk for them, because I think sometimes we just assume that, or the doctor just assumes that hygienists don't need loops, much less need a light. And that is absolutely wrong. Okay. You really have to have your hygienist have a light. But with the ISOLITE 3, we've got a light, right? The one thing though that is sometimes you got to think about the time of having to take it out and flip it over, okay? And most importantly, thinking about the patients that you're seeing. And but I will say that it is nice to have that, and again, being able to have the patient being open at least for the right side, and then we're going to move it to the left side, right? And I'm not a hygienist, but I can imagine what it would be like. The other thing is I think the ISOLITE was such a perk with the light during my procedure, and being able to turn that ambient light down was really, really nice. It gave me as a patient peace of mind, although not all patients know that that's what we're doing. But I think for my doctor and myself, it was a peace of mind. The other thing is just being able to shut and turn off the light. I think when we think about patients' anxiety, that was really cool. And I mean that was really cool to be able to have that. So I am very, very excited for the ISOLITE 3. Again, the only thing I can say is just having to, for it to be disposable. You got to be ready for that. When we think about the DRYSHIELD, the number one perk was autoclavable. Number one, autoclavable. Because again, you try it in, doesn't fit, it's gone, right? And I know somebody out there is going to try to cold sterilize this thing and use it over and over and over. But when it says, one-time use, it's one-time use. So I think the biggest perk was that. The other thing is I like the hook. Again, I thought that was huge. And I'm sure if there's any rep watching or listening, to this tonight, they're like, really? Out of all the things, that's one of the things that you like? Yeah, it was. I think that was a huge plus because, again, you never know what type of or how old the equipment that we're utilizing. The other thing is that I like the fact that it's set up higher in the holder. I think that was huge. Sitting up higher, was, again, a nice perk. So, and the slender design. So, think about that. But again, I think the best part about that was the being autoclavable. Now, let's talk about the Mr. Thirsty. Mr. Thirsty is a great alternative if we need disposable and we really need to think about economics. It is very, very economical. And so when my team is crying about not having an ISOLITE or having a DRYSHIELD, I can hand them the Mr. Thirsty. And they're still getting the best of both worlds, right? But again, if you got a really big practice, you have to look at those things. And but I feel like the time that was saved is the same amount of time with the Mr. Thirsty as it was with the DRYSHIELD and the ISOLITE. The time is the same. I don't care what the manufacturer tells you. All 3 of those, the time was the same. The placement was the same, okay? Pretty much the size was very similar. Yes, you've got 6 options versus the 2 from Mr. Thirsty, but sometimes giving the team too many options is confusing. So I think that was a huge plus. The other thing is that we always get asked, is that as strong as the other 2 systems? Yeah, I did not really see a big difference. The only difference with the ISOLITE 3 is that we could turn down the amount of suction that we really needed. So I think that was kind of neat. That was cool. But with the Mr. Thirsty, I can't poo-poo it by no means because it was soft. It was easy to place. I will say that the only downside to that was you really want to use the hose. You really need the hose because I like having a little bit longer area to, to hang off the patient. And again, that was the only thing that I really wanted and I'm utilizing is the hose. Let's talk about the relief. The relief being disposable. If you're not comfortable having a bite block, which some doctors aren't and some hygienists aren't. One of the hygienists is a really good friend of mine in Dr. Sinclair's office, cannot live without these reliefs. They order them religiously. They love them for, proofing or using an air polisher. They will not use an air polisher on a patient if they don't have it. And so that was kind of neat to hear their feedback on it. Love the fact that it was disposable, very similar to a dry angle. So if you're doing sealants, I think that's huge. And then having it, again, be disposable, buying it in a pack of 100, that's one of the things you'll have to do because you're tossing them out, right? So you really want to make sure you've got enough on hand, because she'll call me sometimes and say, hey, do you have any extra reliefs? And so, just making sure you have that. But those 3 hoses you can utilize and have them autoclaved, but you really want to always have enough hoses so you can do that. And then last but not least, the PURVAC. The biggest perk from the PURVAC, I think, was, first of all, having the wider end suction. Second of all, having a light or a mirror that you feel like you could get some reflection, but most importantly, it didn't fog. That was probably the biggest perk, I think, other than the wide end. Now, the one downside to it is that hose is stiff. It is stiff. I'm not gonna lie to you. It's stiff. So if I could say anything to DENTSPLY SIRONA, I would say maybe using a softer hose just to make sure of that. And I think there's probably a reason why it is stiff. I'm not sure what it is yet, but I will say that really controlling those aerosols, and like I said with Lynn, doing these herpetic lesions, oh man, she goes straight for the PURVAC. So I think, there's something to be said for that. And all of these pieces of equipment have a place in your practice. And again, I'm spoiled because I'm gonna have all 5. But I will say that I really enjoyed it. And I thank so much to Shine for allowing me to utilize all of these, but most importantly, the manufacturers to let me give you my evaluation, but most importantly, let me be honest, because I would tell you that I think all of these were amazing. And again, uses for all different types of procedures and maybe for different clinicians. So it was fun. I really, really wish I'd had more time. I think more to do my evaluation. That was the only thing that I would like to have had more of, but I can assure you that every one of these, you really can't go wrong. You just have to think about what procedures you're going to be utilizing it for, and making sure that you're not just pushing it off on a team member. Like if you're a dentist and you're doing restorative, not having the same for maybe your hygienist, maybe giving them a chance to try it or understand. And I think if I could leave you with anything, get your rep in that office to really, again, talk about the differences, let you make sure you have enough understanding of how each one works, because there's nobody that knows more than the Henry Schein reps, because they're trained on every one of these pieces of equipment. They know. So, don't just assume they're there to sell you something. They're there to educate you to find out what's the best for your practice, okay? So I want to pause here now, and I want to give plenty of time for you to be able to answer or ask me questions that I can answer for you. And most importantly, I want you to know you can always reach out to me. I'm Shannon at chairsideassisting.com. Shannon at chairsideassisting.com. Getting tongue-tied. My website is the Academy of Chairside Assisting. And again, I am so grateful for this chance and opportunity to be able to share with you my thoughts. And so let's now go into some of your questions. And if there's some questions that we don't have a chance to answer tonight, feel free to email me, and I'll be more than happy to answer those. So let's jump to our questions.